Hi, my name is Nor Anati Soleha and my matrix number is 24003116. Today I'm going to talk about the pulmonary embolism. So, what is pulmonary embolism? Pulmonary embolism is a serious medical condition that occurs when a blood clot, usually originating from the deep veins of the legs or pelvis, travel through the bloodstream and become lodged in one of the arteries of the lung. This blockage prevents normal blood flow, causing a sudden drop in oxygen levels and forcing the heart to work harder to push blood through the obstructed vessel. Because of this, patient may experience symptoms such as sudden shortness of breath, sharp chest pain, rapid heartbeat, or even collapse. Pulmonary embolism is considered a medical emergency because if the clot is large or not treated in time, it can be life-threatening if not treated quickly. So that's all from me. Now I will pass to my friend to tell more about the pulmonary embolism.
My name is Noridaya, matric number 3079. My topic is clinical manifestation of pulmonary embolism. The first one is sudden breathing difficulty. The most common sign is sudden shortness of breath. A person may feel like they can't catch their breath even while resting. This happens because a blood clot blocks blood flow inside the lungs. Next, we look for chest pain. It usually sharp, stabbing, and gets worse when the person breathes deeply. This type of pain is called pleuritic chest pain. The next one is fast breathing and fast heart rate. To compensate for low oxygen, the body reacts quickly. You will notice rapid breathing, also known as tachypnea, and fast heart rate, called tachycardia. These are early warning signs that the body is under stress. The next sign and symptom is cough or bloody sputum. Some patients develop a cough which may be dry, or in more severe cases, they may cough up blood-tinged sputum, also known as hemoptysis. The next one is low oxygen or hypoxia. When blood flow to the lung is blocked, oxygen level drop. This can cause restlessness, anxiety, dizziness, or confusion. A pulse oximeter may show a low SpO2. The next one is sign of DVT. Pulmonary embolism often starts with a clot in the leg called deep vein thrombosis or DVT. So, check for leg swelling, redness, warmth, or pain, usually on the one side only. The last one, in severe cases, in massive pulmonary embolism, symptoms become dramatic. The patient may experience fainting, low blood pressure, or even sign of shock. This is medical emergency. In summary, recognizing this symptom early can save a life. Sudden breathlessness, chest pain, fast breathing, low oxygen, and DVT signs, these are the clue the body gives. If you notice them, seek medical help immediately. Remember, early detection of pulmonary embolism makes all the difference.
Hi, my name is Siti Usnabeti Azaha. My matric number is 24003125. Today, I want to talk about diagnostic tests used to detect pulmonary embolism. The first one is D-dimer test. Tips blood test checks for fibrinogen breakdowns products. A normal D-dimer makes pulmonary embolism very unlikely. If the D-dimer level is elevated, the next step is imaging. The most important imaging test is CT pulmonary angiography or CTPA. This is the current gold standard, allowing direct visualizations of any clots within the pulmonary arteries of helping confirm the diagnostic of pulmonary embolism. The third one is ventilation perfusion scan or VA scan for patients who cannot receive contrast dye, like those with kidney failure or pregnancy. A high probability mismatch strongly suggests pulmonary embolism. Number 4 is lower limb Doppler to find source of the clots. A Doppler ultrasound of the legs is performed. Other supportive tests such as ECG, arterial blood gas, ABG, and chest X-ray may be performed, but they are not definitive. CT pulmonary angiography remains the gold standard for confirming the diagnosis of pulmonary embolism. So here is a visual summary of the diagnostic tests we've gone through, showing the main tools used in detecting pulmonary embolism. That's all from me. Thank you.
Hello everyone, my name is Maria Batrisha binti Zainul and my metric number is 2400300N0. Today I will explain about complication of pulmonary embolism. Pulmonary embolism can lead to several serious complications such as acute right side heart failure due to increased pressure on the right ventricle, cardiogenic shock, and severe hypoxemia, which can progress to respiratory failure. In some cases, the blockage may cause pulmonary infection, where lung tissue die due to lack of blood supply. Patients are also at risk of current embolism if the underlying causes is not treated, and long-term cases may develop chronic thromboembolic pulmonary hypertension such CTEPH, which can lead to persistent breathlessness and reduced functional capacity. Most critically, a massive pulmonary embolism can result in sudden cardiac arrest and death. That's all for me. Thank you.
Assalamualaikum. My name is Anatus binti Zaimi, 24003089, and today I'm going to talk about the treatment of pulmonary embolism. First is medicine, include different types of blood thinners and clot dissolvers. For blood thinners, this blood thinning medicine called anticoagulants prevent existing clots from getting bigger and new clots from forming while your body works to break the clots. Heparin is frequently used anticoagulant that can be given through a vein or injected under the skin. It acts quickly and is often given along with an oral anticoagulant such as warfarin until the oral medicine becomes effective. Next is clot dissolvers. While clots usually dissolve on their own, sometimes thrombolytics medicine that dissolve clots given through a vein can dissolve clots quickly. Because this clot-busting medicine can cause sudden and severe bleeding, they usually are reserved for life-threatening situations. Second is surgical and other procedures like clot removal. If you have a large life-threatening clot in your lung, your healthcare provider may remove it using a thin, flexible catheter threaded through your blood vessel. Next is vein filter. A catheter also can be used to position a filter in the body main vein, the inferior vena cava that leads from your legs to the right side of your heart. The filter can help keep clots from going to your lungs. This procedure is usually only used for people who can take anticoagulants, drugs, or those who get blood clots even with the use of anticoagulants. And some filters can be removed when no longer needed. That's all for me. Thank you.
Hi, my name is Alif Irshad Biotman. My metric number is 24003065. Okay, today I'm going to explain the management of pulmonary embolism. Pulmonary embolism is a medical emergency where the blood vessels in the lungs become blocked by a blood clot, so treatment must be done quickly. The first step is to stabilize the patient. Make sure the airway is clear. Provide oxygen therapy to maintain an SpO2 above 94%. If the patient is in severe respiratory distress, intubation may be required. Circulation. We insert an IV line, monitor blood pressure, heart rate, and sign of shock. The next step is to start anticoagulation therapy. This helps stop new clot from forming and prevents the existing clot from getting bigger. Examples of anticoagulant include low molecular weight heparin, unfractionated heparin, DOAC, like Epi-7 or Rivaroxaban. This treatment is started as soon as possible unless the patient has a high bleeding risk. If the patient have massive pulmonary embolism, For example, low blood pressure or shock, we use thrombolytic therapy such as alteplase. The purpose is to break down the clot quickly. If thrombolytics are not suitable or the case is very critical, doctor may perform procedures such as catheter-directed thrombectomy or surgical removal of the clot, known as pulmonary embolectomy. If the patient cannot take anticoagulants at all, an IVC filter may be inserted to prevent clots from traveling the lungs. Supportive care includes giving analgesic for pain, continuous cardiac monitoring, and careful fluid management. For long-term care, the patient will continue anticoagulant medication for 3 to 6 months or longer depending on their condition. We also educate the patient to avoid prolonged sitting, stop smoking, stay active, and maintain good hydration to reduce clot formation. As nurse, our key responsibilities are monitor respiratory status and oxygen saturation, position the patient in semi-bolus to ease breathing. Monitor blood pressure, heart rate, and ECG. Watch for sign of bleeding because the patient is on anticoagulants. Educate the patient about medications, follow-up appointments, and ways to prevent pulmonary embolism recurrence. In conclusions, the management of pulmonary embolism required rapid action to stabilize the patient, begin anticoagulant.
So hello everyone, my name is Nur Amatul Ghaffar. My matrix number is 2400327. So today I will talk about nursing care, nursing diagnosis, impaired gas exchange related to ventilation provision mismatch secondary to pulmonary embolism. So this is the intervention and rationale. So first, assess respiratory status. Rationale to identify the degree of respiratory distress and hypoxia. Second, monitor vital signs and SpO2. Rationale reflects changes in hemodynamic stability and oxygenation. Third, administer oxygen therapy. Rationale to increase available oxygen and reduce hypoxia. Next, fourth, position in semi-fowler or hypofowler. Rationale to enhance lung expansion and ventilation. Fifth, administer anticoagulants or thrombolytics as ordered, such as heparin. Rationale to prevent new clots and help dissolve the embolus. 6. Maintain bed rest. Rationale to reduce oxygen demand and prevent clot dislodgement. 7. Monitor for signs of bleeding. Rationale because anticoagulants increase bleeding risk. Number 8. Provide reassurance and reduce anxiety. Rationale because the anxiety can increase oxygen consumption and worsens dyspnea. Number 9. Encourage deep breathing exercise when stable. Rationale to improve ventilations and prevent atelectasis. Lastly, number 10. Prepare patient for diagnostic test. Rationale to confirm pulmonary embolism and guide treatment decisions. So that's all from me.